917, welcome back. The Delta variant of COVID-19 virus is the dominant variant in the U.S. It is highly transmissible. That is the big problem. But there is another strain of the virus that the World Health Organization is calling a variant of interest, the Lambda variant. Something you might start to hear more about. The first case of the Lambda variant was found in a Texas hospital last week. But down in South America, it is the most prevalent strain, accounting for 84% of the cases in Peru right now. What does this all mean, though, with this new variant? What does it mean when it says of interest, and how worried should we be? Dr. Purvi Parikh joins us this morning. She is an immunologist with Allergy and Asthma Network, who is also a co-investigator with COVID vaccine trials. So she knows a little bit about this, obviously, and we're so happy that you're here to discuss this. So what does it mean when it says of interest? Is this something we should be concerned about?
Right, absolutely, especially now that, travel has increased, more people are moving about, a lot of precautions have relaxed. It can very easily become the dominant variant in the U.S. Already we have cases spotted in Texas, so it's only a matter of time before more of the country is affected.
So for people who don't know, the variants are named after the Greek alphabet, so they're coming in that order. The Lambda variant is the newer strain, right? Or is there something else that's developing that we don't know yet about, but we're going to hear about in a couple days or next week?
Correct. This is the newest one of interest. There are others that also have been identified, but because this has become so prevalent in South America and is at risk of, becoming prevalent in the U.S. already, we already have that one case. That's why we're talking about it now. The bigger concern with these new variants is that we get to a variant where our vaccines are no longer effective. So far, including the Delta variant, the vaccines are very good at keeping people out of the hospital, keeping them from dying. And now this Lambda variant is being tested against all the other vaccines that are currently available. So hopefully that continues to be the case, because we don't want to get to a point where there's a variant where our vaccines are not working as well.
Well, so here, how does this work? So once we find out there's another variant, right, because the virus mutates and changes, is that when doctors or professionals start testing it out and seeing how it does with the vaccine? How does that process work?
Yeah, so as soon as we have one identified and we're seeing an increase in cases like we have with the Lambda and previously with the Delta, immediately we start testing it with our vaccines just to make sure that that neutralization activity is still holding up. And then we're also looking at the people who get sick with it. If they're vaccinated, are they ending up in the hospital? Are they ending up, passing away from it? So these are all important questions that come up every time a new variant comes out. But the best way to avoid these variants is to get vaccinated, because if the virus can't spread from person to person, we don't have to worry about these new variants popping up that could be more contagious and deadly.
Okay, so the Lambda variant of interest, the Delta variant right now, which we're dealing with, of concern. What do we know about the Lambda variant? Because the Delta variant is highly transmissible. What do we know about Lambda, and what can we expect moving forward?
Right, so this is also highly transmissible. So we don't know if it's more so than the Delta variant, but we know already in a very short amount of time, the virus has spread rapidly throughout South America. We're seeing cases in Texas. So again, it's definitely much more contagious than the original strains of the virus that we had earlier in the pandemic. And it's yet to be determined if it's more deadly and more dangerous. Delta, we believe, is so, because it not only is more contagious, it causes much higher loads of the virus in your body, in your airways, so it's much harder to fight off. So, time will tell, and stay tuned, but for sure it is extremely transmissible, the Lambda variant.
Dr. Parikh, before we let you go, just real quick, because people are concerned about, well, how many more variants are there going to be? How do these emerge? Is there a way to kind of gauge what's going to happen come fall and winter?
Yeah, they emerge basically through people who are unvaccinated, because as the virus spreads from person to person, it's smart, it evolves and it mutates. So, the only way we'll know how many more will come depends on the general public, and them getting their vaccinations, them still continuing those mitigation measures like masking. The CDC is now recommending it again for indoors. All of these things will dictate how many more variants we have. So in a way, it's in our hands to kind of curb this pandemic.
So you're saying if people don't get vaccinated, more variants are to come?
Yes, absolutely. And if people don't mask and follow the local public health guidelines, more variants will come as well.
Doctor, thank you so much for your time. We don't want to make people panic, but it is definitely something that we have to keep an eye on because we're trying to prevent this from becoming a bigger thing, and we don't want to be where we were this time last year. Thank you for your time again. Appreciate it. Okay.